Greta Macaire is from the fourth major center who is on our agenda today, I'm proud to say. So we've heard from Cedars-Sinai, we've heard from Stanford, we've heard from UCLA, and Greta is an oncology dietitian at the University of California at San Francisco. She is a certified specialist in oncology nutrition, a CSO, which is the highest credential given to registered dietitians for expertise in cancer nutrition. And we asked her to make the trip down here, which she did despite having a plane canceled and everything else, just to be with you, because she is so wonderful and always gets such wonderful reviews from our audiences when they actually get to not only hear from her, but ask some questions about diet. So without any further ado, Greta Macaire.
Can I see over the podium? That's the question. Okay. And then as far as advancing the slides. The green arrow. Okay. All right. Well, I'm so excited to be here today, and it's great to see you all. I'm going to be talking about nutrition and its role in managing neuroendocrine tumors. And I kind of break this talk up into sort of three areas. One is first just looking at some healthy eating basics, and then talking about nutrition during cancer treatment, and also talking about carcinoid syndrome and diet. So a lot of people come to me when they first get referred to me and say, well, how can nutrition help me? What can you do for me? And we know that nutrition is very helpful for people dealing with cancer treatment in that it can improve their tolerance to treatments. It can promote overall health and wellness, support their immune system, help with side effect management. And all of these things help nutrition to be a very complementary therapy in terms of complementing the traditional treatments that you will be going through. So we know that good nutrition improves treatment tolerance. Good nutrition during cancer treatment is associated with decreased complications and infections, fewer treatment breaks and faster recovery, improved strength and energy, and even improved survival and outcome. But for some people, just meeting their basic needs can become a major challenge as they go through cancer treatment. So sometimes just getting enough calories, getting enough fluids is a huge challenge. So we need to sort of look at all of those aspects of what's going on with you. And so I always kind of think about, well, what's important when we're creating a healthy eating plan for somebody as they go through their treatment. And we always want to focus on nutrient-rich foods and focus on whole foods. But we also need to think about things like timing of meals and snacks. So are you somebody that's feeling really full and has a poor appetite? Well, you might need to be eating multiple small meals throughout the day. Plenty of fluids are important, but how you take those fluids might need to be sipping on fluids between your meals so you don't get too full, or having liquids that also have nutrients so that you can get enough calories and enough nutrients throughout the day. Then we need to think about you. What are your food preferences? What are your individual needs? So you are going to have some individual needs than your neighbor sitting next to you. You might have another health condition that impacts what you can eat. You might have carcinoid syndrome, whereas the person next to you has a neuroendocrine tumor and doesn't have carcinoid syndrome. So we need to think about what are your individual needs and how much food preparation can you do. So these are all the kinds of things you want to be thinking about when we're thinking about what is the right diet for you. It's very individualized is what I really want you to know. This is an individual thing. There's no one right diet for everybody. The American Institute for Cancer Research does have some guidelines which we look to and we're sort of like, okay, what is a healthy eating plan for somebody that has cancer? And they use the guidelines that they've developed for cancer prevention, or what I like to say is cancer risk reduction, because we can't necessarily prevent cancer through diet and lifestyle, but it is estimated that in the United States, in adults, we could reduce the risk of cancer by 30 to 35% by following these three major guidelines, which are to choose mostly plant foods, limit red meats, and avoid processed meats. Being physically active for 30 minutes a day or most days or more, and aiming to be a healthy weight. And so a lot of people say, well, these are for reducing risk. What about when somebody already has cancer? And the studies actually show, this is a more detailed list that they have on their website, which is the AICR.org website, but the number 10 recommendation is after treatment, cancer survivors should follow the recommendations for cancer prevention. And that's primarily because the studies thus far are showing that cancer survivors that follow the same type of recommendations that are associated with a lower risk of cancer seem to have healthier lives after their cancer diagnosis, less complications, and do better overall. So this is sort of a good blueprint when you're looking at how to put your meals together, just in terms of thinking about what a plant-based diet would look like. It doesn't necessarily mean that there's no animal food on your plate or that it's a completely vegan diet. But the studies show that if the plate or your meals and your diet is composed of about 2/3 or more from plant foods, so things like vegetables, fruits, beans, nuts, whole grains, and 1/3 or less coming from animal protein, meat, chicken, fish, dairy products, then you're really getting the benefits of a plant-based diet. And the one thing I would say that's really important is to think about the whole diet. So there really is no one good or bad food. So when you hear about a magic bullet food, it's probably, there's really nothing to that. You know, we really need to look at what are you getting from your whole diet, and a more plant-based diet is going to provide vitamins, minerals, lots of chemicals that we get from plant foods called phytochemicals, which are colorful plant compounds. You know, we don't want to eat a lot of red meat or processed meat, but it's not necessarily that those are bad foods if they're eaten in small quantities, or if you want to enjoy a little bit of a dessert from time to time, it's not necessarily the thing that I focus on. I want you to focus on what are you doing 80% of the time. What does 80% of your diet look like? So I mentioned these phytonutrients or phytochemicals, and one of the things that I think is really, should really be stressed when we're looking at what we eat is getting a rainbow in your diet every day, trying to get as many colors as you can, because the colorful compounds in plant foods are these phytochemicals, which at a cellular level affect our cell health by acting as anti-inflammatories, antioxidants. They boost our immune system, they help our body to detoxify compounds that can promote cancer. So they're really the little cellular compounds in foods that are helping our cells be healthy at a microscopic level. And they're found in all the different, they're found not only in fruits and vegetables, but tea, green tea, herbs and spices, so things like cinnamon and curry. All these foods are loaded with these phytonutrients. And so if you can think about getting at least, 3 to 5 different colors in your diet almost every day, then you're going to be getting a wide array of these very important phytonutrients or phytochemicals. And studies really show that it's best to get them from food as often as possible, because there's a synergistic effect between these compounds. One example being that green tea, you can actually absorb the phytochemicals more so when there's a little bit of lemon juice added to it. Now, if you were taking green tea extract, you probably wouldn't get the extra benefit of having that squeeze of lemon in there because it wouldn't be in your green tea pill. So there's thousands of these phytochemicals that actually work, help the compounds work better together, should we say. So if you can get it from your diet, that's definitely the route that I would recommend. I also just wanted to point out the benefits of omega-3 fatty acids, because they're not necessarily only in plant foods, but these are essential fats. So we want to get these fats, we need them for various health-promoting properties in our body. In terms of cancer, they've been associated with decreased cancer-related weight loss and fatigue. They help support our immune system, and there's benefits for heart health and mood. Where do we get them in our diet? Well, standard American diet doesn't have a lot of omega-3 fatty acid food sources, because they're found in cold water fatty fish, so things like wild salmon, trout, herring, sablefish, and sardines. We get them in some plant foods like flaxseed, specifically ground flaxseed is the best way to absorb the omega-3s from flax, walnuts, pumpkin seeds, and chia seeds. And so really to obtain an adequate amount of omega-3s, it's recommended to try to plan to get a plant source in your diet almost every day if you can, a little handful of walnuts, a handful of pumpkin seeds, and then aim for about 2 servings of cold water fatty fish a week. And that way you're getting the long chain, the animal source of omega-3, and then the plant source of omega-3. I also wanted to mention vitamin D, also because it's not necessarily high in a plant-based diet, but it is very important. It's important for our immune function. It's important for normal cell cycle process, so keeping our cells healthy and developing, reducing inflammation, and then it's important for muscle strength and bone health. And you know, about 75% of Americans have insufficient levels of vitamin D, so we just don't get enough vitamin D because we're not out in the sun very much. We wear sunscreen, which is important, but that blocks our ability to make vitamin D when we're out in the sun. And again, the food sources are things like fatty fish, eggs, fortified foods, and then dietary supplements. So not a lot of vitamin D in the food supply. And adults need 800 or more international units per day of vitamin D3, which can typically be obtained from a multivitamin or an individual vitamin D supplement. Some people get enough from the sun and from their diet, but I do usually recommend to have your vitamin D level checked. It's a blood test, and specifically if you're somebody that's dealing with chronic diarrhea or malabsorption from pancreatic insufficiency, because it's a fat-soluble vitamin. So if you're losing a lot in your stool, you're going to have a low vitamin D level, and you're probably going to need a higher supplementation level than this 800 international units. So I just want to summarize the healthy eating guidelines and then kind of go on to nutrition during treatment. So we want to focus on a balanced diet with a variety of foods, primarily plant-based, but very nutrient-dense. So I know French fries and potato chips are plant-based foods, but that's not really what I'm talking about here. Choosing fruits and vegetables of intense color, choosing whole grains over refined choices. So when you look at your breads, you want the first ingredient to say whole. Choosing lean and plant protein sources, limiting the added sugars and the processed fats. If something has more than 5 ingredients, it probably has a lot of added sugar and some processed fat. So that's one good thing you can think about when you're going to the grocery store. Look for things with 5 ingredients or less. Adequate fluids, but limiting the sugary drinks and alcohol. Being physically active, maintaining a healthy weight. And then the next thing we think about is how is this going to change when you're going through treatment? Because it can be hard to follow all these guidelines in your day-to-day life. But if you're struggling with various side effects, it's going to make it even harder. So we know that for people that are going through cancer treatment, there's nutrition-related side effects. There's, for some people, carcinoid syndrome is going to cause difficulties with nutrition. Specific types of tumors or syndromes can cause difficulty with nutrition. So insulinomas, gastrinomas, VIPomas all can have some nutrition consequences associated with them. And then again, other medical issues that might need to be thought about. So things like diabetes or kidney problems and how that might need to be figured into your overall food plan. So we've got a lot of side effects, and you know, many of you may have had all of these side effects at some point. But again, we've heard about fatigue being a big issue, obviously the digestive problems, poor appetite. And I always think of it as sort of like trying to eat as if you're trying to navigate through a roadblock or eat while you're walking through an obstacle course. It can be pretty difficult to do. So I'm just going to focus in on one of the side effects because we could probably, you know, we could spend quite a bit of time talking about what you could do, how you could manage any of those side effects better through making dietary changes. But I feel like diarrhea is a pretty common side effect that I get patients referred to me to help them with their diarrhea. And so there's can be a variety of causes in people with neuroendocrine tumors. So we could be looking at diarrhea from carcinoid syndrome. We could be looking at diarrhea that's malabsorption after a pancreatic surgery, or for somebody that's on long-term octreotide treatment, they may develop pancreatic insufficiency and be getting diarrhea from that. They could have had a major bowel resection and have some long ongoing diarrhea. So it comes up a lot. But the first thing I would say is when you're having loose stools and watery stools, you're losing fluid, and dehydration can result, and electrolyte imbalances can result. So it's always really key to think about replacing fluids and electrolytes, making sure that you're getting 8 to 10 cups of liquid a day. It doesn't have to be clear liquid, but clear liquid can be the easiest to digest when you're having loose stools and can be very hydrating. And then thinking about electrolytes that you're also going to be potentially losing in watery stools. Primarily it's potassium and sodium. So really good sources of potassium are things like baked potatoes, coconut water, soy milk, melons, cooked spinach, bananas, avocados. These are all good sources of potassium. And then for sodium, good ways to replace sodium is through broth, saltines, pretzels, even adding a little bit of salt to your food can help replace the sodium that you might be losing. The next thing to think about is how can you decrease the demands on your GI tract? How can you make your GI tract not so unhappy? And the first thing I would suggest is eating smaller, more frequent meals, because the larger the meal, the more stress you're going to put on your digestive system. So breaking that meal up into 2 meals and having 4 to 6 little meals throughout the day is typically going to be easier for your digestive system to handle. Chewing your food. A lot of people eat fast. We eat in the car. We are rushing around through life. But if you chew your food really well, you're starting a lot of the digestive process right there. So take time, chew your food really well, slow down, and that helps decrease the effects on your GI system. Limit intestinal irritants, so things that can promote diarrhea or loose stools. So these are things like magnesium, especially magnesium supplements, caffeine, and then extreme hot and cold temperatures. So having things more room temperature or lukewarm can be easier on your system. And then avoiding fatty, greasy foods, so pizza, bacon cheeseburgers, things like that will all provoke irritation to your GI system. And limiting concentrated sweets. So those would be things like sodas, even 100% fruit juice can sometimes just be too sweet and your stomach can't really handle that. Even sometimes thinking about nutrition supplements that you might be drinking as a way to gain weight or get extra calories. Some of those can be extremely sweet and actually cause more diarrhea, so you may need to make your own smoothie or water it down so that it's just not as irritating on your system. And then sugar alcohols are things like sorbitol and mannitol. These are found a lot of times in medications or diet candy, and we don't digest those, and they'll cause more diarrhea or loose stools. Lactose, which is the carbohydrate in milk products. Sometimes people develop lactose intolerance when they're getting cancer treatment. And so maybe you're always fine having milk to drink before, but suddenly whenever you have it, it gives you more gas, bloating, and diarrhea. So limiting lactose can be helpful. So using lactose-free milk or a non-dairy milk like almond milk or rice milk. Yogurt usually is pretty well tolerated because the healthy bacteria have digested all the lactose. You can also use lactate pills, which are enzyme pills that you take when you eat a dairy product, and that helps you break down the lactose and you get less GI symptoms. Avoiding gas-forming foods and foods high in insoluble fiber can be very helpful. So what are gas-forming foods? Those are things like onions, cabbage, broccoli, cauliflower, soft drinks, beans, and chewing gum. So these are a pretty good list there. Gas can be really painful, so if we can reduce adding foods into our system that are going to cause more gas, it can take a little bit of that stress off. Insoluble fiber is all the undigestible components of fruits and vegetables and whole grains. So it's all the outer packages, the peels and the seeds, and they act like a broom as they go through your digestive system. So they basically cause food to pass through more quickly, and that's going to increase loose stools. So examples of foods high in insoluble fiber would be raw, unpeeled fruits, dried fruits, raw vegetables, whole grain breads and cereals, nuts and seeds. So all the healthy stuff that I was just telling you to eat, right? Now I'm telling you don't eat that. Well, if you're having a lot of loose, watery stools and diarrhea, that's not the healthiest food for you to be eating because it's going to go right through you. You're going to need probably to focus on foods that we call low fiber or low residue foods, because then you're going to actually be able to absorb the nutrients from those foods. So things like white rice or porridge, also known as congee, can be really helpful for stopping watery stools. Peeled potatoes, hot cereals like cream of wheat or oatmeal, and then cooked vegetables and peeled and cooked fruits. These are going to be much higher in what we call soluble fiber. It's like the opposite of insoluble fiber. It's usually in the inside of the fruits or vegetables, and it actually forms a gel in your system and sort of slows everything down. That way you can absorb your nutrients, stay hydrated. So good sources of soluble fiber are things like oat bran, barley, bananas, applesauce, cooked carrots. And you can even take soluble fiber supplements, and that's something that we recommend sometimes for people. And they can be very helpful in just bulking up the stools. And the one thing I would say is definitely talk to your healthcare provider if this is, usually probably your doctor is always asking you about your bowel movements if you have a neuroendocrine tumor. But if not, definitely talk to your doctor or a registered dietitian about what's going on with you, because there might be things that we can suggest. For example, maybe you've been on octreotide for a long time and you're getting diarrhea and it doesn't seem to be getting better even though you've increased the dose. Well, there's probably about 10 or 15% of people that could develop pancreatic insufficiency after being on octreotide for a long time. So pancreatic insufficiency causes you to not be able to digest your food properly, and people get malabsorption and clay-colored stools, a lot of diarrhea, and we can prescribe pancreatic enzymes to help compensate for that, and then you can start absorbing your food again and having formed stools. So there's a lot of things that we could recommend or potentially try that could help with your symptoms. So I'm just going to spend a couple minutes talking about carcinoid syndrome and diet. A subset of people will have carcinoid syndrome. And the symptoms you probably heard about earlier today, but they include flushing, sweating, wheezing, diarrhea, and abdominal pain. So common triggers are obviously the hormone secretions, but certain foods have been linked with an increase in carcinoid syndrome symptoms. So if you have symptoms, diet changes may help. The first thing I would say is, again, you're an individual and you're unique. So not all of these strategies are going to work for you. I really recommend trying to keep a food and symptom log so that you can start seeing what your own individual triggers are, because what some person's trigger is not the next person's trigger, and why avoid something that you really like if it's not a problem for you. So the most common reported food triggers that they have found when they've asked people with carcinoid syndrome are large meals, alcohol, tomatoes, fatty meals, coffee and caffeine, and very spicy foods, and then foods containing high amounts of something called amines, which I'll talk about in a minute. So if you don't have any symptoms, don't change your diet because of hearing about carcinoid syndrome. So a lot of times people will come to me and say, I saw these lists on the internet, should I be following these lists? And they have a neuroendocrine tumor, but they have no symptoms of carcinoid syndrome. So you don't need to follow these guidelines. These are specific for people that are having symptoms. If you do have symptoms and diarrhea is one of your symptoms, first I would say follow the suggestions for diarrhea management that I just talked about. We also want to increase your protein intake, so you need about 20 to 50% more protein than you would normally need so that you can have additional tryptophan. Tryptophan is one of the amino acids that the tumors use when they're producing serotonin. So you don't want to get deficient in amino acids, and so you need to eat more protein. So things like fish, poultry, lean meats, beans, egg whites, low-fat dairy, whey protein powder, whatever protein sources, we need to increase that amount. We usually supplement at our center with a little bit of niacin or nicotinamide, which is no-flush niacin, but it's only a small amount. It's only 25 to 50 milligrams, and that's oftentimes found in a multivitamin. And the hope with that is, again, to avoid a deficiency that potentially could develop a niacin deficiency over time when there's a serotonin-producing tumor. And then what are these amines in foods? And so the main thing, they're basically precursors for adrenaline, and they can increase the symptoms of carcinoid syndrome in some people. So the foods that are most likely to trigger carcinoid symptoms, that have the highest amount of amines, these are the ones I'd say take these out first, see if there's any improvement. They're going to be mostly aged cheeses, alcohol, smoked salted fish and meats, and then yeast extracts, which you primarily will only find in processed foods. So if you looked on a frozen meal, you might look at the ingredients and see hydrolyzed yeast extract, and that would be what the yeast extract that I'm talking about. And then fermented foods like tofu, miso, and sauerkraut. So these have the highest amount of amines, potentially could trigger a carcinoid symptom. Moderate amounts of amines may trigger carcinoid symptoms, not as likely, but if you're really struggling, I usually recommend to take these out of your diet for a while and see if you see an improvement. So again, we're gonna go with caffeine, large amounts of coffee or soda, chocolate, especially dark chocolate. Again, something that we always say is healthy is dark chocolate, but it can have a lot of these amines in it. Certain nuts, peanuts, Brazil nuts, and coconut, avocado, banana, raspberries, most other soy products, and then fava beans. So what's left? What's left to eat? So these are the foods that are the lowest in amines, very unlikely to trigger any kind of symptom. We've got fresh lean meats, poultry, and fish. So if you eat a sandwich, fresh roasted turkey would be a good alternative to a smoked or cured lunch meat that's going to be high in amines. Most vegetables and fruits are very low in amines. Fresh boiled soybeans like edamame that you would get at a Japanese restaurant, soy milk, ricotta cheese, mozzarella cheese, cottage cheese, yogurt, and cream cheese are all the non-aged cheeses that virtually have no amines in them. So these are foods that should be very unlikely to cause any symptoms. So, just to give you a sample menu for a day, because a lot of people think, well, if I have carcinoid syndrome, there's so many things I can't eat. How would I put a meal together? This is just one day. Be oatmeal mixed with some chopped almonds. They're not one of the nuts that are high in amines. A little bit of cinnamon and unsweetened applesauce. Again, it's a cooked peeled fruit, so if you're having loose, watery stools, it's going to help bulk up the stool. And then some herbal tea. Lunch would be good high protein, some roasted free-range chicken breasts with roasted vegetables and a little bit of brown rice. Dinner could be some baked fish, salmon with sweet potato, and vegetables. And then, of course, you want to add those snacks in because you're going to need a little bit more protein and probably eating smaller meals more often. So things like Greek yogurt with blueberries or crackers with hummus or almond butter with a pear or a hard-boiled egg. So just to give you some ideas of ways to put a menu together. So to summarize, I would say that good nutrition is essential to all of our healths. Whatever state of health we're in, good nutrition is very important. And it's a vital component of treatment tolerance, side effect management, and quality of life for neuroendocrine tumor patients. And asked to be referred to a registered dietitian that specializes in oncology nutrition because we have experience in working with you and we probably can help you. We can help optimize your nutritional status. And these are some resources. I'm sure this will be up somewhere for you to get some good websites, some good cookbooks if you're looking for more information on nutrition for cancer. So thank you so much and good luck.